fun here on Arizona Daily Mix. We're going to be talking about our health, and we want to be healthy. And joining us is a chiropractic physician. This is Dr. Michael Robb. Nice to have you on the show.
Thank you for having me.
I'm glad that you brought your gadgets and even, a spine here. We're going to get down and dirty and talk about spinal stenosis.
Correct.
Something that a lot of people don't have open conversations about, but a lot of people are dealing with it. So first and foremost, you are the owner of FIX24, and we want people to use your facility because you do great work there. So tell us a little bit about it.
My office, FIX24, really focuses on spinal stenosis.
Mm-hmm.
It's an epidemic. It's the #1 cause of spinal surgeries in this country. Spinal stenosis has an overall terrible effect on body, the organ physiology, so it's much more involved. And there are a lot of causes for it. There are a lot of corrections for it as well.
All right, well, let's give everybody some insight on what exactly spinal stenosis is, because it sounds very over-the-top and scientific. Instead of just saying, oh, my spine or my back hurts, there's more to it. So explain this to us.
Well, my previous career was working for the U.S. Department of Energy and nuclear engineering facility. So the word stenosis was actually used as an engineering term. It was brought into healthcare by cardiologists describing narrowing arteries. And now orthopedic guys are also using it to describe narrowed openings in which the nerves exit off the spinal cord.
Okay.
So that's really how stenosis was brought into healthcare system.
And there's a lot of people that are like experiencing discomfort and the pain in their lower back, but they don't even go to a chiropractor. They just figure, oh, I'm getting older.
Right. I'm
not sitting up the way I usually sit up, or I'm not taking care of myself. But if you do have these kind of feelings and symptoms, you should see a chiropractor because it could be very severe.
Correct. We know when we look at the anatomical makeup, the most mechanical in the human body is the spinal column. Everything that is mechanical tends to malign. In engineering, we call that the second law of thermodynamics, or the law of entropy.
Okay.
So the front end of a car always wants to come out of alignment.
Right.
This mechanical entity, the spinal column, always wants to come out of alignment. When they do, the bones will deviate posterior. When they do, they narrow that opening.
Oh.
And that's where the nerve gets compressed.
Okay.
That's textbook definition of spinal stenosis. So it's a mechanical problem. Now,
just like our car.
Exactly.
The car front alignment goes out,
right.
It affects everything. Your tires, you're drifting to the side, the way you drive, and you got to get that alignment right. And so the same is with your spine.
That's correct.
So how do we get it right?
Well, we know the #1 cause, and I've been doing this for almost 20 years and almost 9,000 patients.
That's why we have you on the show. You're the expert.
But with all of those cases, every single one of them came in with spinal stenosis. It's not an age-related problem. It is a mechanical problem, and it's brought on by our activities of daily living that involve us putting too much inflection. And that can be exercising, bending over, sleeping in a fetal position, getting dishes out of the dishwasher, clothes out of the dryer. Everything we do is bending forward. We do nothing to bend backwards.
Oh, so we got to reverse it.
That's correct. The excessive bending forward causes biomechanical shifting of the vertebra that go back and narrow those openings and compress the nerves. Those nerves will generate into the muscles and skin. They also control organ physiology.
Okay.
So I have patients that will come in that have heart arrhythmias or bloating or thyroid issues. These things can all be traced back to spinal stenosis.
Wow.
And if you have a spine, you have spinal stenosis.
Just like that alignment in your car. You get that alignment right, everything else falls into place.
That's correct.
So you get your spine right, everything else will fall into place. So what are some things people can do to help prevent this so they don't have these issues down the road?
Yeah. If we look at a simple looking at these rings, if they're in alignment, there's an open diameter. But if they shift out of alignment, that opening narrows.
Right.
So when bones misalign, they go backwards. This is why we need support in our backs. Sit with pillows there. Get a big therapy ball. Bend over backwards on it for 5 minutes a day.
Okay.
And that counterbalances all the flexion that we're doing that's actually destroying our spines, causing stenosis, causing changes in organ physiology.
And again, I want to reiterate, you said that this is not something that happens because you are getting older. It's not an old person's disease or an old person's issue. It can happen to anyone because of the way we're living our lifestyle.
That's right.
So it's just those simple things that we can do to kind of alter it and make it better so we don't have these problems.
Watch kids on cell phones, iPads with their neck in flexion, because that I've seen stenosis in children is 4 years old.
Wow.
So it's a mechanical problem that can occur with anybody who has a spine.
And I went onto your website and I saw the x-ray photos that you had of the spine, which is pretty impressive. The spine that's aligned, and the other one actually had almost like an S.
Yes.
That's pretty severe.
We know that this is a mechanical entity. So every time we have a fall, a slip, an unguarded sneeze, we're putting mechanical stress. It's like driving a car down a dirt road. You're going to jar something out of alignment. Most people don't realize the connection between a bone shifting backwards causing stenosis and changes wherever that nerve innervates.
Well, Dr. Robb,
this is how you maintain your health.
You are fantastic. Great information in a short amount of time. We don't want to have to deal with these pains and problems. If you want more information, you got questions, or you just want to go see Dr. Robb, his website is FIX24wellnessstudio.com. But, of course, we'll have a link on our website, aztv.com. Don't go anywhere. We'll have more when we get back.